Hi. Okay, this is not a personality change. That is a neurotransmitter change. And once you understand that, you have that framework. Everything about how you talk to yourself about this shifts. Okay? Before we go into today's topic, a quick but important note. I'm a physician, but I'm not your physician. Everything I share in this channel is for educational purposes only and is not a substitute for personalized medical advice, treatment, or diagnosis. Please work with a qualified healthcare provider who knows your full medical history before making any changes in your healthcare plan. If you're in crisis or you need immediate support, please reach out to a medical professional or crisis support right away. Welcome back to Coffee with me, Dr. Sarah, the owner and founder of Lush Lifestyle, where I specialize in neurodivergent women's health, hormones, brain health, and longevity, and I am neurodivergent. So today I want to talk about our neurodivergent symptoms that I think causes more suffering than any other, and that is almost never named correctly. It is called oversensitivity, overreacting, emotional immaturity, drama. It has been called borderline personality disorder. It has been called anxiety. It has been called character flaw more times than I can count. But do you want to know what its actual name is? Rejection sensitivity dysphoria. And guess what? It is a neurological event, not a personality one. Okay? It is a neurological event, not a personality one. What reaction sensitivity dysphoria actually is an intense emotional response, okay, to perceived or actual rejection, criticism, or failure, or the sense that you have disappointed someone. Okay? The word dysphoria is important. It means profound unease or unhappiness. This is not just mild disappointment, but sudden, intense emotional pain that can feel completely overwhelming and completely disproportionate to the situation that triggered it. It comes on fast. It is often described as a wave, right? It kind of comes on as a wave, something that hits you before you can think, before you can even reason, before you can even apply any of coping strategies. And then often, just like a wave, it passes. Sometimes as quickly as it can. The wave comes, it hits you, you're kind of down, you sit back up, you're like, what the heck? And it's over. Which makes this even more confusing for women experiencing it and from the people around you, right? Because it's like, what the heck just happened? But here's what I want you to understand neurologically, right? RSD is driven by dopamine dysregulation. Our neurodivergent brain has difficulty regulating dopamine. We already know that, right? We know that. So when a social threat is perceived, so it can be rejection, criticism, disapproval, that dopaminergic response is dysregulated. What would be a manageable emotional signal for a neurotypical brain can become overwhelming neurological event for a neurodivergent brain. And it's not overreacting, right? This is a brain with a different neurochemical response to social pain. So for women with ADHD and autism or dual diagnosis, RSD is compounded by several factors. Several, not just one. First, a lifetime of social correction, right? For neurodivergent girls and those that identify female at birth, we are often told from a young age that we're too much, we're too loud, we're too sensitive, we're too intense, we're too emotional. I mean, think about that. The constant correction wires that threat detection system in our brains to be hypervigilant. Social situations become minefields. The fear of rejection starts to precede actual rejection. We're starting to fear it before it's actually even happening. We're starting to anticipate it. Second is masking. The effort of performing neurotypically is exhausting and carries an enormous emotional cost. When the mask slips, when you say the wrong thing, when you read a social cue incorrectly, or sense that someone is pulling away, guess what? The shame, that response is not just about the moment, it carries the weight of every previous failure to get it right. Third is the misdiagnosis pipeline. Because RSD in women looks like emotional instability. It looks like volatility. It looks like intense interpersonal sensitivity. And it's frequently misdiagnosed as borderline personality disorder. Guess what? The treatments are completely different, right? Getting the wrong one does real harm. If you've been told that you have bipolar and something about that diagnosis has never quite fit, it's worth asking whether RSD in that context of undiagnosed, undertreated neurodivergence might be a more accurate framework. I'm not saying that everyone with bipolar is misdiagnosed. Okay. I'm saying if you don't feel like that's the right diagnosis, maybe it isn't. Maybe it's worth looking into. Maybe it's worth asking questions. And here's where it really gets especially relevant for midlife because RSD does not stay consistent across the cycle, just like everything else, right? Why does your neurodivergence get worse when you're in luteal phase? It gets significantly worse in luteal the 2 weeks before your period. Why? Because estrogen is dropping, right? Where progesterone is low too. This is because we know estrogen supports serotonin, right? It supports dopamine. It helps regulate that emotional reactivity. That helps us, those things help us buffer our nervous system and social pain. So we have less ability to do that, right? So this is why so many women describe their emotional regulation as completely falling apart a week or sometimes 2 weeks before their period. It's a neurochemical shift, ladies. It's a neurochemical shift. And then when we enter in perimenopause, where estrogen fluctuates unpredictably, not just in luteal, right? RSD can feel consistent, not cyclic anymore, right? It can feel very, very constant. Understanding this does not make the pain smaller, but it does make it less mysterious, right? There is this phenomenon of when we can understand why something is happening, we put more reason to it, right? And it opens up the door to interventions that actually can start addressing it. Okay. So what help actually looks like? I want to be honest here. RSD is one of the harder neurodivergent symptoms to treat, but it's not untreatable, right? Understanding it is the first intervention. We always say understanding, naming something, getting something diagnosed is the beginning, right? It's that first step. Then we can look at, then the journey begins, right? Then the journey begins because none of this is easy. If there was a pill or a supplement to fix all of these things, we would. There isn't, right? There isn't. So understanding is the first piece. And simply decide your way out changes the relationship you have with it. Medication that addresses your neurodivergence and dopamine regulation may help, right? Many patients report that their symptoms are better managed when they are on medication. Also, adding in the hormonal layer, right? We support the estrogen, the progesterone, the testosterone. We support that prefrontal cortex. And many women will say, yes, this is helping, right? This is helping. But I want to say this, and I want to say this clearly, and this is true for all of the things that we do in life and all of this. There is no one size fits all. Even if you are going and reading in these communities and they say, I did this and this helped me, it may not help you. And that's okay. You are you, and I am me, right? That's like Dr. Seuss over here. But we have to figure out what works for us. And you need to work with someone who understands the neurodivergent brain, who understands hormonal changes and fluctuations, and can help you navigate that all the way down to the cellular level. Right? Is it perfect? No. Is it going to be a work in progress? Yes. Yes, yes, yes. We're all work in progresses, but there is hope. Okay. And we can make it better and we can improve it. We just have to ask the right questions and look at ourselves, how we do this. Okay. So like always, if this video gave you language for something you've been living with, please, please, please share it. Come on over, subscribe, come on over to Substack. I'd love to have you as part of the tribe over there. Remember, articles come out Monday and Wednesday. You're amazing. You're amazing. I'd love to see you there. So as always, until next time, stay well.